Hey, Dr. Lindsey and Wendy here. This is a little update on a 34-year-old, I think he's Egyptian.
He is Egyptian.
Medical professional that is pretty obsessive. And so, he originally came in. He's got good Middle Eastern hair. It's thick, wiry, good hair, covers well. He's got fairly brown skin like I have, and there's not a ton of color contrast like there are in some of the people. And you see when he pulls his hair back, he's worried about his hairline. And if you look closely, the two little triangles needed, 1,400 grafts.
Just a little.
Probably didn't even need that much, but trying to deal with a doctor can be challenging.
It is.
And so, everybody's an expert on a field that they're not in. And so we did his case, so here he is at 13 months. I think he looks really good, don't you?
He looks very natural. He came by, was it yesterday?
Well, hang on. Go back to at 13 months. He looked natural, but I think he had some issues going on with females. Right?
Yes, he did. But he broke up with her.
Well, I'm just telling you, women
Wait,
can
they make
cause
you lose
me
hair? It causes you gray hair.
It causes me gray hair.
Causes some patients some hair loss.
So anyhow, this doctor decided he needed a few more grafts put along that hairline, and so we ended up doing a couple hundred FUEs on him, and right around 13 or 14 months out from his strip. And then he came too much, and I had to tell him to.
He just needed a little bit more hand holding because he wanted it to be perfect.
And perfection is the enemy of good. You start worrying too much, and it's going to torture me, you, and your hair.
But how did it turn out? It turned out great.
So he rolls in yesterday, Memorial Day, which we're open doing a case, and he looks awesome.
He does look great.
I think he looks about like he did at 13 months, but he's convinced he looks significantly better, and his scar,
If you recall, this is what happened. You are very big on cleaning.
Mm-hmm. Oh yeah.
He was a little crusty, and when he came for the sutures, and Dr. Lindsey said, "You're crusty. You're a little crusty. You didn't wash." And the patient goes, washes his head right here.
Maybe he did pull a few hairs.
And then he pulled some hairs. He thought, or he did pull some hairs, but it was already. He was already traumatized by you saying, you didn't clean good enough. But, so that's why all he had in his head through the whole year where it was growing is that I need to put a little bit more here. And we did put it, we did. We
put a few hundred more grafts.
Yeah.
And then the other thing he said to me yesterday was he's always worried about his strip scar. I'm going to show you his strip scar, both a still and during the video. It's an awesome strip scar. Nobody's seeing that thing. I mean, it's probably one of the best strip scars.
Well, what if the girlfriend just touches it and feels that?
He did mention yesterday that he worries when the new girlfriend touches the back of his head.
I don't like anybody touching my hair.
Yeah. So, anyhow, take a look at this. Okay, so we did some work on you a year or two ago, and then
16 months ago.
You're a little uptight, and we did a little more to your hairline. Bend over just a little bit.
Sure, of course.
And you're a doctor, and that looks awesome. I mean, you got that thick Middle Eastern hair. Would you turn around one time? I just want to show the back of your head. I will not get your face. There it is. So I'd give that a B+, maybe an A-. It's hard to find. This is a great example of a conservative case on a thick-haired Middle Eastern guy who is very obsessive. But I think we got him happy, and at some point down the road, we'll probably be seeing him again because he comes from a family of people with more hair loss. Don't you think?
Yes, we'll see him again, and we'll be happy to
hold his hand again.
Yes.
So if you have questions or we can help you, give us a call. Thanks.